Trastuzumab, more commonly known as Herceptin, is a monoclonal antibody drug targeting HER2/NEU, a tyrosine kinase overexpressed in some breast cancers. As a healthcare professional, you may encounter patients taking this drug for cancer therapy, so it's important you remember all the major facts about this drug. You're in for a treat because we're going to the zoo. Wow, is that coming from the zoo gate? Better let the zookeeper know. Well, it seems more than just this gate has fallen into disrepair. As you can see from the empty enclosures and overflowing trash cans, the zoo is absolutely trashed. You can use this trashed zoo to remember the drug trastuzumab. Trashed zoo sounds a lot like trastuzumab, doesn't it? The mab suffix in trastuzumab is an abbreviation for monoclonal antibody, which is the type of drug trastuzumab is. It targets the HER2/NEU receptor, which we'll talk about next. The zoo started to fall apart when the beloved old head zookeeper got too old to work. After he passed, his zoo went to his businessman's son, who only cared about selling off the animals to make a quick buck. It seems that the zookeeper passed a few days ago, and today happens to be his funeral ceremony. Notice the hearse inside the zoo? That's because the old zookeeper loved this zoo so much that he wanted to be buried here. This hearse is our symbol for HER2/NEU, the tyrosine kinase receptor targeted by trastuzumab. Get it? Hearse for HER2? HER2/NEU is overexpressed by certain cancers, in which it works to promote growth of cancer cells. Trastuzumab works by specifically targeting and blocking HER2, which is where its trade name Herceptin comes from. Now that the HER2 hearse is approaching, let's take a closer look at those in attendance. There's the zookeeper's wife, who's wearing a pink ribbon in her hair, and the greedy businessman's son. Notice how this ribbon is shaped like the pink breast cancer ribbon? That's right, this pink ribbon will help you remember that trastuzumab is used to treat breast cancer. Basically, certain breast cancers may be HER2 positive, which means that these cancers overexpress the HER2 receptor. In other words, the growth of these cancer cells may be dependent on HER2 signaling. Trastuzumab kills these cancer cells by blocking HER2 signaling, as well as by inducing antibody-dependent cell-mediated cytotoxicity. Basically, it functions as an antibody that not only blocks the growth signaling provided by HER2, but also signals NK cells and other types of immune cells to kill cancer cells once it binds. While breast cancer is the most classic cancer that overexpresses HER2, some stomach and gastric cancers can also express HER2. As such, trastuzumab may also be used to treat HER2-positive gastric cancer. But for test day, you should really just associate trastuzumab with breast cancer. Got that? Now that we've discussed how trastuzumab works and what it treats, let's touch on one important side effect. No funeral ceremony is complete without a memorial of the deceased, and this is no different. The floral arrangement has been skillfully arranged into a heart to hold the photo of the zookeeper in the center. This heart-shaped memorial should help you remember, well, the heart, since one of trastuzumab's most important side effects is cardiotoxicity, or damage to the heart. In fact, trastuzumab has a black box or severe warning for cardiotoxicity. Unaddressed, cardiotoxicity may eventually lead to heart failure. It is important to monitor patients receiving trastuzumab for early signs of cardiotoxicity, and avoid giving trastuzumab to patients with pre-existing heart conditions. The way exam writers will get you here is to ask you what kind of pre-screening work should be done before starting therapy. Generally speaking, you should assess the cardiac function, usually using something like an echocardiogram. Alright, we're done with trastuzumab. The funeral ceremony is ending, as is our video. Let's recap and pay our respects to the old zookeeper. Trastuzumab is a monoclonal antibody against HER2/NEU, a tyrosine kinase receptor overexpressed in some breast and gastric cancers. As a result, trastuzumab is an effective treatment for cancers expressing HER2. An extremely important side effect to watch out for with trastuzumab is cardiotoxicity. Alright, it's time to head out. Until next time.